heart scans, called also echocardiograms. That is examination which help us assess the heart disease. That is using ultrasound waves to have a look on the structure of the heart, shape, and then assess any problems, function of that heart, and make plan of the future treatment if it's needed. Yes, thanks to the heart scan, we are able to find out why we can hear that murmur, and then we can assess if any treatment is needed. We can do early detection of changes in the heart, and then start with the early treatment, which can prolong our animals' safe, happy life. So abdominal ultrasounds is a very nice examination which also use ultrasound waves to have a look inside our pets' bellies, and then it allows us to see the size, the shape, and sometimes also the functioning of the internal organs like liver, spleen, kidneys, bladder, adrenals, and like everything which inside that bellies. Most of the time not, especially with the abdominal scans. We perform that under light sedation, that they could be nice and chilled during my ultrasound examination. For the heart scans, we don't doing any sedation, but they have that nice atmosphere prepared, and then we have some nurse helping to hold the pet on a little table. They're lying on the side, they're getting a lot of cuddles, so it's most of the time stressless procedure. No, it's very nice and easy procedure. There is small risk connected with the sedation, but our nurse team is monitoring the animal during all the procedure, and we can reverse that sedation on any time if we have any concern that something is going wrong. The animals getting all oxygen that they need. The ultrasound waves make no harm, there is no pain, and like I said before, there is no radiation during the ultrasound examination. It takes from 15 to 60 minutes, depend of what problem we're looking for and the size of the animal, and most of the time is actually the sedation monitoring.